Hi, my name is Josh Hartzell, and I'm one of the infectious disease physicians here at Walter Reed. Myself and Lieutenant Colonel Brian Neubauer, the Chief of General Internal Medicine, are going to review with you some of the outpatient management and our clinical approach to COVID-19 here at Walter Reed. I'd like to start by giving you just a brief overview of the clinical symptoms of COVID-19. The majority of patients are going to have mild symptoms. Most are characterized as a flu-like illness with fever, sore throat, and headache. While the majority of patients who are admitted will ultimately have fever, there are patients initially as outpatients who will not have fevers, so fever alone should not be a discriminating factor. For most patients, you can be managed at home with COVID-19 and don't need to come to the clinic or the hospital to be treated. In fact, we would prefer that most patients stay at home and manage their symptoms there rather than going out. This helps to eliminate spread of the disease. I want to start by the fact that if you have these symptoms at home, and you're concerned or about what you should do, you can always call the clinic and we can provide guidance on what to do next. For patients who develop symptoms at home who might have comorbidities such as asthma, COPD, or malignancies, you should come in and be tested. The other thing to think about is even though you may manage your symptoms initially at home, if you develop symptoms that are more concerning such as shortness of breath, chest pain or chest pressure, or confusion or inability to arouse either in yourself or whoever you're the caregiver for, or if you develop bluish lips, you should most certainly come in. If you develop severe symptoms, respiratory distress at home, you should call 911. When advising patients, please use what I just talked about when talking to them on the phone. And again, if a patient is unsure, we can always recommend that they come in and be evaluated. As I go through the next several parts, I just want to iterate that most of the data I'm pulling is coming directly from the CDC website. So for patients at home, they're going to be concerned about how they can manage their symptoms and what they can do in terms of protecting themselves and their families from becoming infected. The CDC has a 10 ways to manage respiratory symptoms at home handout that is available on their website. The link to that is going to be on the same webpage as this video. In addition, the CDC also has an entire section dedicated to the care of COVID patients at home. I'm not going to review all that here on the video, but simply point you to that website so that you can review it and re-review it as needed. Finally, the other question that will often come up is when can I leave home if I do have symptoms and haven't been tested? Based on the CDC guidelines, anyone can leave home after they've no longer had fevers for 72 hours, their symptoms are improving, and it's been at least 7 days from when their symptoms began. Again, if you have questions about that, please refer to the CDC website. So what I've covered is just a brief overview of some of the outpatient manifestations and treatment approaches to COVID at home. And again, on these handouts that will be listed, we'll also cover in detail how patients can deal with things such as cleaning their clothes, staying isolated in rooms, and other ways to protect themselves at home. With that, I'm going to turn it over to Lieutenant Colonel Neubauer.